A systematic review focuses on a specific question. A systematic review uses explicit, pre-planned scientific methods to identify, select, appraise, and summarize similar but separate studies. Reviews summarize knowledge, and here are the 4 steps that differentiate a systematic review from a traditional narrative review, which is to identify all evidence on the topic, select them, appraise the quality of these evidence and summarize them. Only a subset of systematic reviews will include meta-analysis, which is statistical methods that people can use to quantify and combine the results from several independent studies. Let's take a look at what a traditional narrative review is and how is it different from a systematic review. Almost all of us started writing about review articles very early on, probably in elementary school. And reviews are important because we cannot read everything and digest them. There are more than 23,000 medical journals, and if you want to keep up to date, you have to read about 90 journals in full every day. However, most of us were not taught how to write review articles. So, we have double standards here. Try to remember how you write your review articles. Not your systematic reviews, but the narrative review articles. Probably you're going to the library and look for few papers that support your hypothesis. So, in doing narrative reviews, most people are highlighting and cherry-picking what they like and what fit their hypothesis. There is no standard format. Here is an early study that showed how the traditional narrative reviews are different from systematic reviews and meta-analysis. Here the authors look at the medical reviews published in the medical literature from the 1985 to 1986, and then 1996, as well as reviews published on epidemiological topics from the 1997 to 1999. They compared these 3 types of reviews to meta-analysis, identifying 1996. If we look at the parameters, or the domains, that the authors have evaluated, whether that review has addressed a focused question, described methods for locating evidence, or used explicit criteria to select studies, you will see that meta-analysis, which is shown on the last column, have a higher likelihood of addressing a focused question and having explicit methods for selecting and locating evidence. So meta-analysis, 95% of them has met that criteria, comparing to less than half of all the other reviews. So that shows you a systematic review is really different from a narrative review. It has to focus on a clinical question or a research question and use pre-specified methods to identify all evidence on the topic. Critically appraise the evidence and the synthesized evidence in a coherent way. How do you do a systematic review? First of all, you have to establish your research team, and it's important to have content and methods experts on your team. And then you're going to develop your process of gathering stakeholder input, formulating your research question, minimize bias and conflicts of interest. And then as the next step, you would develop your protocol. In the protocol you're going to outline the steps you're going to use for doing a systematic review. And this is very important step, because again it differentiates a systematic review from a narrative review. In other words, we're using a very transparent and replicable process of doing a systematic review. Like you would work on a bench signs or doing an experiment on animals, you will have a protocol. Here, we will have a protocol for doing systematic reviews. After you have your protocol written, you can start your review process by collecting your data, locating the studies, screening the results, and then abstract the data and appraise the risk of bias in the individual studies. After that, which is now on step 5, you will synthesize your findings, interpret, and assess the overall body of evidence. Your report writing was summarized everything you have done so far, and a good thing about systematic reviews is that it can be updated. Meaning that, let's say a few more studies published after your systematic review is done, a few years later down the road, you could always update your systematic review based on the same protocol that you have started. Again, systematic review is just a way how we summarize evidence. And it is a transparent, reproducible way of summarizing evidence. And the methods could be applied to any field. You probably have heard of evidence-based healthcare, evidence-based medicine, public health policy. Apply it to your own field. It's not simply oriented to clinical trials or clinical practices, but that said, most methods we're going to learn come from clinical trials. That's where the methods come from.